record this record this training just in case people want to refer back to it later. Hopefully this will help. So we're gonna get started. Welcome, how's everybody doing? So typically when I do my little training sessions, I have discussions, so I would like to be able to hear everybody's voice. And what I would like is that you share questions or whatever in the text box, and then if I can answer them, I'll ask you to share your question out loud, or I'll try to respond to you individually. But we have some information to go over. So this is just the beginning. Like the chief said, we'll probably do at least 4 sessions of this, but depending on how the conversation goes and what all we need to cover. Some people have done this before. We've had this we did this in, I believe it was April of 2019. So the majority, well, I would probably say half of our group now did not participate in the DMC 101 when we had the group from DC come down. So this is going to be a quick and a dirty, but this is also going to be a little bit of history about what we've been doing. So hopefully it'll be able to catch everybody up to speed slowly but surely. All right, so can everybody see this? Yeah? Can you hear me? Thumbs up, thumbs down? Okay, all right. So nobody's gonna talk to me?
Hey, how you doing?
I'm like, am I in the room by myself? Okay. Okay, all right. So really quickly, so this is a community and systems. So what we're gonna do is work on identifying strategies to reduce DMC and RED. Hopefully by now you all have heard me say it often enough, but I will keep saying it over and over again to you. Get really familiar with it. So I wanted us to do introductions really quickly, and I wanted to know what your interest is or what your agency's interest is in DMC RED. So if we could go around the room real quick, that would really help me.
I'll go first.
Okay.
My name is Officer May. I am the Domestic Violence and Family Services Officer for Kinston Police Department, and I think our interest in this is just learning to communicate better with citizens in general, with minorities in general, and have a better interaction with people just in the community in general, just better communication.
Okay.
Better involvement, better relationships.
Okay.
I'll go next.
Okay.
I'll go next. I'm Cassandra Suggs, behavior specialist for Lenoir County Public Schools. The collaboration with DMC, it was actually someone else that used to work as a behavior specialist, was going to the meetings and attending, and he left and I kind of took his role on. But we work with some of the same, we do some of the same stuff in the school system. Not exactly, but we do work with a lot of minorities. They have a lot of issues behaviorally and emotionally. So it kind of goes hand in hand, the work that we do. So learning more and taking those trainings back to the teachers so they're able to understand differences in students and how to interact with different students. It really helps.
Okay. Thank you. So
I can go. Melissa Reed with this point. And I'm very new to this group. And so I'm learning. I'm new to Lenoir County also, because I cover Duplin and Sampson also. So I'm excited to learn more about this. And in the process, I'm learning more about Lenoir County too. So I'm just excited to be here. And then maybe I can share in some of my other counties.
Okay, sounds good.
Thank you.
Aaron. Are you there?
This is Jennifer. Can you hear me?
Yes, I can.
All right. So I am Jennifer Mervin. I am the Victim Services Coordinator / Operations Director with Safe Lenoir County.
Okay.
We are the local domestic violence agency serving both Lenoir and Greene County. And Leg is our director here. Of course, you know, domestic violence does not discriminate, but we do have the tendency of seeing domestic violence in some cultures more so than others. So this is my first time actually being with the DMC one-on-one, and I look forward to working with everyone. I've already spoken with Ms. Sydney May today. I see some of the faces and some of the names that I'm already familiar with. And so just whatever it is that we can do to help the community be better and educating the community as far as what is really out there, then we're on board with that.
Great.
Thank you.
Mr. Mumford, you want to go next?
Yeah, I was about to say, I guess I'll go. I am James Mumford. I am actually a minister, elder, reverend, whatever you want to call it, in the community. I am here representing, I guess, Prevention and Treatment Center, but also just parents, concerned parents and citizens who I advocate every day for through civic engagement, community organizing, on a number of committees and stuff. So yeah, I'm deeply rooted in this type of work. So this is what I do. So I'm just excited to be here. That's all.
Thank you. Is that everybody, I think? Okay. So I thought we were gonna have a few other people, but that's cool. So let's start this again. So for some of you all who may or may not, a few of you all know me by now though, I'm Linnea Foster. I am the project director for this grant, but I'm the executive director of a nonprofit called Southeast Community Resources. And what we do is we do a lot of capacity building work with nonprofit organizations and agencies across the state and across the country, where we're working to address racial and ethnic disparities in state and local systems. And so that's kind of how I got into this work. Hopefully that kind of helps you. I'll tell you more about all my many multiple jobs and all my many multiple works over the years as we go on. So what we're going to do is over the course of these 4 weeks is we're going to go over learning some of the definitions of RED and DMC. We're going to learn some key values and approaches for effective system reform. We're going to learn strategies for productive conversations about race. We're going to learn strategies to reduce impact of implicit bias, and sometimes I like to call it explicit bias. We're going to learn about effective reforms at key decision points, and we're going to plan next steps for eliminating RED. So we won't cover all these today. We will probably do the top 3, and we'll hit other pieces in and out at different times. So why is this issue important? Well, obviously because we are hearing all of these names of these high-profile incidents that have happened across the country. And these are just some of the names. That this year alone, there have been hundreds of police-involved shootings or different race-related shootings that have happened in the country. And so, as we know, this is a hot topic / issue that is affecting the whole entire country. There's no place that is immune to this type of possibility of happening. And so what we're trying to do is, one, do a little prevention work and build relationships and create, if possible, a system that's accountable, effective, and fair. Another part of the reason why this work is important is without having these kind of conversations, it's really hard to have people rely on trust, or to be able to say that they trust community partners and government agencies. And they start to question the integrity of agencies. And overall, I think it jeopardizes community safety. And so we want to work on community safety holistically, and that people are able to kind of engage at different levels of safety, whether it be fire, police, paramedics, 911, mental health services. We want to make sure that the community as a whole is safe. And so part of my question was, when you all are able to talk to me again, and so why is this issue important to Kinston-Lenior? And this is a question that I have for you all. Why is it important? Beepin, talk to me.
Well, I think this is, from my perspective, this is important to Kinston-Lenior because some of the things, as you stated on the PowerPoint, why it's important: accountability, effectiveness, fairness, to build trust, integrity, and community safety. People feel that those areas need work on, as far as the community and community partners, residents, and so we know, given what has been going on a national level, state level, and local, in terms of police reform and criminal justice reform and systemic everything, right? That these areas need to be addressed so that you can forge a more united community.
Right.
Is this what you're saying?
Yeah. That's really good. Anybody else? Any other thoughts about why this is important for Kinston? That actually tells me a lot, though.
It does.
It actually tells me a lot, because what I'm looking for is for people to be connected. If you don't know what the problem is, you can't know what the solution is. So that really is very enlightening.
And Leanne also for people to be comfortable talking about this.
Yeah.
Because I'm comfortable talking about it, but I realize other people aren't, because it's probably not a part of their daily conversations and work. So. Right.
So what I'm going to take this to mean is that people don't know exactly why it's not comfortable, or they don't know why this affects Kinston specifically, or Lenior specifically. And I will, there's Mr. Burns. So why does this affect us, and why is this a concern that we need to address? Mr. Burns, are you there? Can you speak? I know you just popped back in. Might not be able to talk. Well, I'll go over that. Yes, is somebody gonna say something?
No, I mean, I was just, I'm just brand new to all this.
Yeah,
so
there's no right or wrong
answer. I
answer.
want to learn why. I mean, I think it's good to be having these discussions in all of our counties. So I don't know specifically, just because I am brand new. So I do look forward to hearing, which you've shared some statistics and stuff already. So
yeah. But and part of it is that I'm sometimes when I first started visiting Kinston in 2018, the conversation was about the kids don't have anything to do. Or the conversation was about kids not being respectful. And so it was a lot of different people had a lot of different approaches as to why there was so much contact.
Okay.
And so so that's part of the reason why I asked that question, because I want to know what people think about the issue itself and what people are thinking about it, because then that gives me a chance to see all the different perspectives and experiences. So I'm very open. I want to say that again. I'm very open to hearing what people have to say. It's no, this isn't a trick question. I don't do trick questions. There's no winning with trick questions. So, so anyway, but I'm going to go over more data. You obviously, people, if you know me for like 5 minutes, you know that I love data. So we will go into data, but I wanted to make sure that that I gave people a chance to explain what they thought about why this is affecting, why is this important to Kinston. Does anybody else have any thoughts before I move on? Okay. So why is this issue important in terms of the consequences? This is a big question that I think a lot of people need to think about, and why community-wise, you need to know what the consequences are to DMC and RED. So what are some of the consequences? Because to be honest with you, most people know these things, but you might not know. So one of them is mass incarceration, right? Thoughts? There's no trick question. What other things are consequences to this? Anyone? Anyone?
Juveniles having records starting at young ages.
Great. Yeah.
I went to a meeting with, I think it's CIT, and several juveniles are getting charged with assaults, and it doesn't allow them to become CNAs or medical technicians in the health field.
Right. Yeah. What else? That's great. What else? Any other thoughts about what are some of the effects, the concerns, the consequences of DMC? Is anybody else there? Good Lord. I guess not. All right, we'll move on. But those are great suggestions. Those are good. All right, so that is. So some of the causes of RED, obviously, or some of them you may not know of, are negative stereotypes, media images, differential risk factors, and that could be poverty, that could be mental health, that could be disability, it could be a lot of different things, racism, historical disadvantage, differential enforcement of the law, disparities in other systems, maybe in social services or in the public schools, differential processing by juvenile justice system, structural bias in the juvenile justice system, and implicit/explicit bias among system participants or actors. Are there any other causes of RED that you can think of in regards to this? So here are some of the common disparity drivers, and what do we mean by disparity drivers? So these are groups or agencies or systems that cause typically racial disparity, or that we see more individuals coming in contact with the system as a result of these systems. So obviously, in general, like youth trespassing or something like that, people calling the police and saying, hey, there's a kid here that shouldn't be there, or misdemeanors in general. That could be like, I don't know, what would be a good misdemeanor? That would be simple. Shoplifting, like penny candy or something like that, the school to prison pipeline. So that could be people getting suspended or, you know, maybe getting into a fight at school. Disorderly conduct, that could be just for people, I think in general. Uh-oh, I got a question. Use of drugs, that'd be a great one. Any other, so then child welfare, obviously if the child has some, or parent in some cases make some kind of contact, you could end up with a contact with a young person. Also age, you know, in general, if you're a certain age group category, you're gonna make contact with the juvenile justice system. Is there any other one that you could see that's missing from this list? Common disparity drivers, common things that kind of send kids into this DMC RED situation. No trick questions or answer. No? But drugs, you're absolutely right. That's a good one. I think mental health is one that should be on this list. Is there anything else that you can think of with young people in particular? So another thing for a lot of places, probably not in Kinston, would be runaway or homeless youth. That'd be another thing that I could see that could be on this list. Domestic assaults would be a good one as well. Yeah, absolutely. Gang activity, yes, that would be great. Yeah. Those are all great. All right, so that's good. Thank you for pinging in. All right. So what we're going to do is, or what our work typically does, is it's going to focus on either the individual, the institution, or society. And why do you think that is?
How about all three?
Mm-hmm.
It's not just one. Yeah, yeah. It's not just one of those areas that have brought us to this table, so to speak.
Mm-hmm.
It's the combination of all of them.
Mm-hmm. And what is there any, is there one that's more responsible or less responsible?
I would say in most cases, not all cases, but in most cases, I mean, they're equally responsible. I think everything kind of affects everything. You know, one thing affects the next.
Mm-hmm. That's good. So for our work in general, we're going to approach it from the institutional focus. There will be times that we will look at the individual and societal, but in general, what we're looking for is institutional interventions as much as possible. And why do you think that is? Normally when I teach my classes, I like have toys on the table. We play with candy and stuff like that. So much more fun. This is hard to do. But how do we, why do you think institutional would be the focal point of what we're trying to do?
I kind of want to guess, but
Go for it, guess. I mean, it's really.
So I'm thinking, I'm gonna throw it out there. I don't know. I'm thinking that when you talk institutional, you have to look at two words: policy and procedure. And so you can easily change that, I guess, more so than societal, because that would be a larger aspect of fun, to look at the individual. Individuals, yes, we know institutionally that I think many are affected institutionally by institutional issues, policies. If I had to guess, Leanne, I don't.
No, I mean you're doing great. You're doing great. You're doing great. Everybody, there's no wrong answer. The idea is that institutionally, like you said, that there are policies, there's procedures you can measure, you can modify, you can do all kinds of different things for institutional things. It is harder. You can measure societal as well, but but it takes more work, more instruction. And I think typically the approach that I'm trying to take, or that we're working to take, is a hybrid of societal and institutional, and encouraging individuals to take responsibility and ownership as well. But we can't do everything all at once. So for our focal point of our work, we're going to focus on institutional work primarily. But by us doing this community process, that allows us to start approaching the societal aspects of this, if that makes sense. Yes, no, maybe so. Okay. So I don't know, some of you all might have seen this before, but part of what we do is to be able to affect policy and to be able to affect the structural or the institutional work, is we need to be able to measure the disparity. And that's where my data stuff comes in. And what we're looking to understand is what the differences are in the disparity, so that we know exactly what we're talking about when we're trying to do some work and addressing it. So sometimes the disparity will be simply overrepresentation. And we've had conversations about that before, about disproportionate. Why is it this way? What's the connection to all of that? That's just a basic overrepresentation. And then disparate treatment is, once you make a connection, right, with the system, how are you treated? Are you treated, do you get the same treatment that other people get? Do you get the same resources that other people get? Do you get the same, I guess you could say, mercy that other people get? And how can we measure that? And how can we address the disparity in that treatment if we can? And then the last thing is unnecessary entry and movement deeper into the youth justice system. And what do you think about that? What do you think that is?
What do we think about unnecessary entry, or you just
what is
all
it?
three?
What is it? What is unnecessary entry and movement deeper into the system? I like to think of it as in terms of escalation. Can we address the issue at the lowest level possible, with the lowest level of connection, with the lowest level of intervention? So if someone makes contact at school, do they need to make contact beyond school? Do they need to make contact with the police department? Do they need to make contact with the jail? Do they need to make contact with confinement? We want to find out, do they need to make contact with a judge? Right? So what we're trying to find out is, how can we minimize the levels of a young person having interaction within the system itself. So that is part of the reason why our focal point or the two focal points that we work on addressing with this DMC in particular, we're working on arrest and suspension. Does that make sense now why we picked those? Yeah, okay. Any thoughts about that? I know some people weren't around in the very beginning to learn that, but that's why we picked those two intervention points.
I think that will kind of go hand in hand a little bit with expert treatment. You're not going to treat everyone the same, even at the lowest level. It's gonna take into account the age. You wouldn't treat a teenager the same way you would do somebody that's a lot younger than a teenager. Unfortunately, it has a lot to do with race. I mean, it's just it's a lot of stuff to take into account.
Any other thoughts about that? So this is going to give, this is how we measure disparity, and this is what we go. So how can we address overrepresentation? How can we address disparate treatment? And how can we address unnecessary entry and movement? Which is why I like to call it escalation. How can we keep it at the lowest level possible? Okay. Any thoughts, questions? All right. So this is red. I don't know if you all can see this. Do I need to make it bigger? I'll make it bigger. So this is red in the U.S. justice system. So this is us as a nation. And I want you to kind of all take a peek. So the gray, the first column is everybody. So in general, almost 27 cases per 1,000 are in the U.S. population of youth in the justice system. So this is in general. This is all of the numbers come together, all. And then 21% basically is white. Right? And then the black is minority. And the green is black. Are black people. Now, what I think is really important is to see that across the whole entire system, you're going to see black people almost doubly represented historically. And the question is, what is it about the system, the connection? This doesn't just happen, in isolation. This has been an issue for well over 20, 30 years. And longer than that, actually. But what is it? Go ahead.
This is Susie Sutton. Can you hear me?
Yes, I can.
Oh, okay, because I couldn't get on Zoom today, but I'm on the phone.
Okay.
A lot of it has to do with the way the system is set up. The system is set up so that they always make money, often African Americans or people that don't really have a voice for themselves. And when I say that, anytime they start a program, they get grants, and they use these same statistics to get money. But the money doesn't benefit us. I don't know where the money is going or how they're using the money, but we're not being benefited from these programs, and these programs go on and on and on, and it has been so, I know, in my work history for the past 35, 50 years. And we're still addressing the same issues. And it's really beginning to bother me even more now because, I'm seeing things that I didn't see, and maybe I can say things that I couldn't say back then when I was drawing a paycheck. But now it's just a way that they can use the system to get money from Black and brown children. And they have to keep them in a certain position so that the money doesn't dry up.
Mm-hmm. Mm-hmm.
That's the way I see it.
I don't disagree with that concern or that question. I think it's clear that there is some disparity in that. So I don't think there's any rebutting what you're saying. And that's part of the reason why we're doing this, is because my hope is that people like yourself, I wish you had your name on there. Is Susie? Did I say that right?
Yes.
Okay. That part of it is that people come, like you, come to the table and we start talking about what is it that we want our young people to have to, or when they make contact with the system, what is it that we want them to be the result of, or what are the outcomes that we're looking for? And go ahead.
But I don't ever hear of any positive outcomes. And I'm not saying that there isn't any. I don't ever hear of any. And I've done some things with the juvenile justice system on the state and local level.
Mm-hmm.
And everybody ends up in the system. I don't see any positive things coming out of these programs.
And when you talk, I'm just going to clarify, when you talk about these programs, you're meaning which program?
Any program that they have started.
Okay.
Whether it's prevention or interaction or whatever the program is to address, I'm not seeing a lot of positive outcomes.
Well, I think in general, the justice system is not designed to be encouraging or character developing. It's a punishment-oriented system. But local communities have a lot of power and authority, and they can make policies that then their police departments, that their county sheriff have to abide by. And so it's important for you all to be able to say, this is what we want our community to look like and function like and work like. And this is how we want to prioritize our work. This is how we want you to prioritize your interactions. And this is not how we want our children to be treated, or this is how we want our children to be treated. And we should be able to have dialogues, because you have a chief that's here that you can call, and he comes and he meets with people every month. And we can say, look, chief, this is how we would like to see young people that have interactions with your department because of fighting. This is how we want the interaction to go. And
can the chief hear me?
He's left, but I'm gonna share this recording with him and let him know.
Hey, Linnea, I'm listening as well.
Oh, Janae's there. Janae's here. The deputy chief is here. She's listening.
Yeah, because I haven't found that to be so in any areas that I have worked in, because the only thing they say, well, they're not going to do this, they're not going to do that. How do you know what they're going to do until that you give them some opportunities to change? A lot of these children don't want to be bad, but it's a survival technique for them, being bad.
Mm-hmm.
And so, we've got to be able to offer them something that another avenue. And it's going to have to start in their homes. It's going to have to start in their environment, places that they live, that they function day by day.
Right. And what I would suggest is that it happens both places. It happens at the system level and it happens at home. And that we shouldn't let it just be, when one group gets it together, then the other group can come along and do what they need to do. We all need to be all hands on deck, addressing the problem from our perspective, what we can do, which is why I asked in the very beginning, what agency are you from and what's your interest in doing this? So thank you this is really good. Did you have something else to say? I don't want to. But thank you for saying that.
Yeah.
Did you have something to say, Mr. Mumford?
Yeah, I think the thought early on, from what I've read about prisons and the whole establishment, was the thought early on was rehab. but that's more problematic than in and of itself. And so it went to this massive buy-in, which we call mass incarceration or the prison industrial complex. And so what you have is buy-in, like we're talking about now, stakeholders, right? And so it went from rehab to more about dollars and setting budgets and people being paid off of those budgets. So the focus has shifted from rehab to, dollars, so to speak.
Okay, and this isn't the end. This is just the beginning because I'm trying to get you all caught up so that when we have these bigger conversations, we can go, okay, so remembering back to looking at this data and seeing that this is the issue that's not only just affecting us here, but it's affecting the whole entire country. This conversation, every person, every community needs to be aware and go, this is what we're going to do about not encouraging or adding our young people to this system as much as we can, if that makes sense. Yes, no, maybe so, up, down. Okay. All right. So again, here's what do you call it? An example of overrepresentation. So, and this could actually kind of be our chart. So this is just African American youth and the percentage of the total population. So African American youth account for 51% of judicially waived. They account for 40, almost 41% of the adjudicated and placed, 36% of adjudicated in probation, cases adjudicated, cases petitioned, cases detained, cases diverted, cases referred to court. But they represent African American youth, 14% of the population.
Say that again,
This is
Leanne. How much of the population? I
14
ain't trying to laugh, but
no,
I'm just, it is ridiculous.
But this is an example of overrepresentation. Yeah. I'm just trying to make sure you understand when it's in front of you, this is what it is.
Yeah. So say that again. What was the percentage for?
14.7 is the part of the population that African American youth account for. But they're 51% of judicially waived. They're 40%. So on every level, we're more overrepresented than we should be. So, I mean, even if you think about COVID, right? And you think about all that there are, what is it, 1 million Americans now that have had some kind of contact or some kind of diagnosis with COVID, but still overwhelmingly, it's the minority communities that are having the higher rates of death. And what does that mean? That's overrepresentation. Okay? I know it's heavy. So spared treatment. This is, and all of this data comes from OJJDP. Uh-oh, I got a question. Chat. Can I get to it? I love this thing. What do you mean by judicially waived? So judicially waived is the people that are moved on into beyond, oh gosh. Wait, Jerry, are you here? Can you hear Mr. Burns? I know I'm not saying the right, because I want to make sure I'm saying the right words. Mr. Burns, are you there? He's not talking. Okay, I'll give you the exact technical definition because I don't want to tell you the wrong thing, but I got you. And I think we use a different term here in North Carolina. transferred to adult court, if that makes sense. But we use a different term. I know we use a different term here. I just can't remember exactly what that term is. Cindy, do you know what I'm talking about? The term that, okay. You're muted. I can't hear you.
I'm sorry, I was looking it up while you were talking about it because I didn't know what it meant either.
Yeah, no, it's a different, I forget what we call it here, but we use a different term for it. But anyway, so disparate treatment. So what we're looking at here is youth with prior admissions, commitment rates in state facilities. So our work in particular is we're not working on commitments because part of what we're trying to do is approach it from what do you call it? I guess you could say like the bigger bucket, the entry point, as opposed to once they're in the system, even though I think eventually we'll need to examine that further about what people's interactions are once they are in the system. But based on what I've seen, it doesn't look like a lot of transfers are happening into the judicial system in Lenoir. And so that's actually a really positive thing but it's the interaction point that concerns me. Thoughts? But this is a case of disparate treatment. And so why this is so in this chart, let me make it big again. So in this chart, what we're looking at is they're grouping the charges, public order, drug, property, violent crime, and then the total, which is the last column. And what we're seeing is that African Americans, again, totally 373 compared to 59. But again, thinking about that African Americans are 14% of the population, right? So you're gonna see the second from the last column is the violence. So African Americans are typically, they're getting charged more with the violent crimes, they're getting charged more with property crimes. But again, they're overrepresented and they're getting disparate treatment, if that makes sense. And why are they getting commitments to state facilities with no prior admission? So that would mean no prior convictions or anything else. Yes, ma'am. Anybody? So why, and part of the questions that we have, or one of the questions that we have about disparate treatment for us is diversion. So how is it that we are diverting young people in Lenoir County? Are young people getting access to, say, teen court? Are they getting access to mental health services? Are they getting access to different programs instead of just being referred into the system?
Are you asking a question?
No, I'm telling you that's what the data is showing.
Oh, yeah, I was going to second what you said. I see that on a daily basis. They are going to those different avenues.
Yes. So the question, why aren't we, or the point is that we're trying to work towards us seeing more referrals, more diversion, and less just being referred to the juvenile justice system. We want to, if we're trying to curb bad behavior, we're trying to say that we're trying to reach out to kids, then the question is, how do we get kids treated? So in particular, so let's say drugs or something like that, how do we get Black kids that are arrested for drug-related things? How do we get them into drug court? How do we get them into mental health or drug counseling, as opposed to them going into the system? Alternative.
Yeah.
Yes.
Leanne, but even at 14% though, you and African American, children will make up 14%, right? Or something like that you said, right?
Mm-hmm.
And then you're talking about those numbers are so high, 47%, as far as what you would think that there are no other ethnic groups caught doing any crime and so that's always been a question too. I know people in the community that I've talked to, like, well, do other kids do crime? Do other people do crime? Because you see this kind of targeting. And so I don't know if you covered that before or yet, but there's a targeting mechanism. And so, because, I mean, the math don't add up. So I guess that's what I'm saying.
Yes, and
The math don't add.
that's overrepresentation.
And that's why sometimes it's good to look at the raw numbers as well as the percentages. And not only that, you were talking about the institutions. The institutions are set up for the Black and brown children. These institutions are set up for them. They're not going to do anything to help these children because that's how they get the money. This is how they keep their job. And if you see programs that are working, then they're gonna have to come up with something else. Come on now, I know you see this as well as I do.
Oh yeah, I see it.
And I think I can agree with Mr. Mumford with the it's not that a certain group is just the only group that's doing certain crimes. I mean, the whole world, it's everybody. It's just, it's based on.
We know that they are doing the crimes, but they are not being charged. They're not being chastised the way the Black and brown children are. If they steal a car, it's the joyride. If our children steal a car, they go to prison. Our kids like joyrides too.
I like that. Yes, our kids like joyride. I think that there's no immune group in the world that doesn't have people that break the law or people that do things that they shouldn't do. It is part of the human condition. That some people rebel, some people, they talk back. That some people fight. We all got something that we do, and no one is immune to it. But I do think how we're treated is important to lay out and go, okay, so why is this group one way and why is another group being treated a different way? And what can we do to make it clear that this is what's happening? And now we want to see how your policies or your work can address these disparities.
May I ask another question?
Yes.
Have you talked to any of the youth to get their opinions on what they see and why they see things happening the way it does?
So I have been a part of that, but I would like us to do an actual youth summit. And we talked about that before, about doing something specifically for young people, to give them a chance to really share their thoughts and opinions and what we can do about it, what strategies they would like to employ to address some of these issues as well. So yes, I would like to do that. And I would like to make sure that it was a safe place for them. Hello, you there?
I'm here.
Okay.
But no, I was just saying, like in everyday conversation, you come in contact with some of these youth that have been in trouble. Have you talked with them? Why did you do this? Why, what were you thinking when you did whatever? That kind of thing.
I think that that's something we've been having conversations about, how we can have more parents and community people having these conversations. And actually this year with the grant, there's supposed to be some funding available to pay for some more outreach in that way and have young people actually kind of leading the conversations. And so hopefully as the grant paperwork and stuff gets finalized, we'll be able to see that come to fruition sooner than later. But yeah, I hear what you're saying. And I think it's important that we figure out how to talk to them. I think what I see overall is that it's a lot of disconnected people. A lot of people that are afraid to talk to each other, afraid to work with each other, afraid to have conflict resolution with each other. And I think that that's what needs to start happening so that we can have some common ground. And that common ground will allow us to have more trust, more integrity, more respect, all those things. That's my take. Go ahead. Who was that?
And since the pandemic, I mean, it's been a little different with having those conversations with a lot of the students I work with, because I haven't seen a lot of them yet. Like I said, school they just came back in on Monday. But the few that I have, seen put their thoughts on social media, or the few that I have had conversations with, it's affecting them. I mean, if we're just talking about everything that's going on in the world, not just COVID, but they see the comments, they see, all the racial disparity, and it's affecting them just as much as it is the adults. A lot of them, some of them are speaking out about it, in the right way, trying to, attend certain protests that happened, months ago or whatever. And then you have some that's just angry, and they're just like, what's the point of speaking out, or what's the point of trying to change when we're already, labeled this certain way. So, I mean, it's hard and it's sad, as far as young, as far as like elementary, they're asking certain questions that you wouldn't expect someone at elementary level to even, be thinking about, they're afraid. They don't know what to expect 10, 15, 20 years from now. So yeah, I think the youth are feeling it. They do see it, they know it, they hear it, and they're not shielded from any of the stuff that's going on.
Absolutely. Anybody else thoughts?
Can I ask what kind of questions they're coming to school and asking you? Like the elementary school age kids?
Like I said, it hasn't been any that I work with as far as them coming to school, because I haven't really talked to, but it's ones that I know personally. Younger ones, like even my nieces and nephews that do go to school, even in Illinois County. And it's certain stuff they have asked, like just speaking about the George Floyd situation, like what's going on. They want to know, what's the issue, or I've had to have that conversation about them when they're riding with certain people, things to do if you were to get pulled over by law enforcement. Some stuff they don't quite understand, like why do I have to do this, or why, but it's conversations that have to be, that has to be held, because they're not going to be that age for long. I have one that'll be a teenager in a couple of years, and I know, with the environment in his community, I can kind of see him going down a certain path. So I kind of want to go ahead and, let him know what to expect, or things he should or should not do. It's not a guarantee that they're going to do that, but at least letting them know, this is the way to do it, and this is what you could possibly expect being a young Black male in America.
And that's a sad case. Expect that.
Yeah, and what the age? I think a lot of people don't know at what age people start to have those conversations. How young? And that people are having those conversations in elementary school. That people have those conversations with people that, your grandfather is telling their grandchild, because they've had those experiences. So, and I think this is a moment that we can share, that we can learn to be vulnerable and share how scary it is to have those conversations. Because I think we don't necessarily tell that either, because we're trying to be strong and not look like, oh, you're, but it's a real thing. I had a little brother, and I remember I had a car accident when I was 18 and he was 11, and the police pulled him away and started questioning him and asking him if he drove the car. And I said, no, he's 11. And they were like, no, ma'am, we're talking to him. And I literally stood in between them and said, no, he's 11. Why are you talking to an 11-year-old? So the conversations are real, and I was getting him ready to go to his elementary school dance. you know, it's an important thing that we all kind of have to share with people and go, hey, this is real. These things are real and they happen to us, and that we all as a culture or as a community, this is how we feel, and this is what we want to see change, because we want our kids to feel safe. We want our kids to have opportunities. We want our kids to not worry about talking to you and feeling like something's going to happen. So thank you for sharing, both of you. Anybody else need to talk before I move on? Okay. This is about unnecessary movement into the system. So just really quickly, on the left-hand side, it's runaway. So this is, again, and then, so these are kids who have been arrested for being a runaway. I don't know if you all do that. I haven't seen any data like that. But some communities, they really do have a lot of that problem. Drug paraphernalia, which I thought was interesting that it's, if you look at this, it's really clear. So it's a lot of white kids primarily being arrested for being a runaway, and Native American kids. And this is still across the country. Drug paraphernalia, again, 180 are out of this group is white kids. And then you're seeing, but Black kids, drug paraphernalia of 35. So I thought that was interesting, because it's almost like the opposite of what we are in Kinston. And what is that about? Or that's a good question to ask. Also, marijuana possession, shoplifting. This is probably more closely to looking like what we are. Underage alcohol, truancy, disorderly conduct. And this one, I think this is where it kind of changes, where you start to see disorderly conduct and simple assault is where you start to see Black kids moving up. But the question is, when they're interacting with the system, how are they moving through the system? Are they moving deeper? Do they end up doing more things or less things? The connection, if that makes sense. Any thoughts about this? So where would you think on this would be example of maybe groups or arrests that they could have avoided?
I have a question, Linnea.
Yes, ma'am.
I'm not sure how great you can hear me. So I'm not following why there's arrests for some of these things. Where
there you go. That's exactly my point. That's exactly my point. So
like you can't physically arrest someone for being a runaway in North Carolina. So I don't understand.
Not in North Carolina. You're right, not in North Carolina, but in California, in Oregon, on the West Coast, they do arrest a lot of young people for being homeless.
Oh, okay.
On the beaches, if you're sleeping on the beaches or on benches, they will arrest you. Actually, in Fayetteville is another place where they arrest you for sleeping on a bench.
But what would the charge? Wouldn't be runaway, would it?
Some places the charge is runaway, depending on what the state laws are. But in Fayetteville, it's I think it's vagrancy or something like that.
Vagrancy.
Yeah, something like that.
Okay.
They charge them with.
Okay.
But it really does depend on the system. So, and I would say part of the other thing is, I think most people don't arrest for truancy. That would be another one, but some places do. And this is the top 8 of what young people are across the country. This isn't just here, but across the country. Yes, no, moving on. Okay. So the question again is, so where should we focus? So what we've talked about before is about institutional. We're going to really spend a lot of time on the institutional and the youth justice system as a whole. And then we'll do a little bit of work on societal or structural racism, but not much. I think what this whole initiative we're trying to do is our societal approach, but we're really going to focus on the institutional. So for our work, our focus has, like I said earlier, is on suspension, and it's on, an arrest. I'm sorry, my brain went blank. And so here are some of the demographics of our local demographics. So the state of North Carolina, obviously, there's 1.4 million people. And this is the school district breakdown, or the breakdown of the populations in the school district. So this would be in the whole North Carolina, 1.2 are American Indian, 3.5 are Asian, 25% are Black, 18% are Hispanic, 4% multiracial, less than 1/10 Pacific Islander, and 47% white. And that's the whole state of North Carolina. The county of Lenoir, though, is different. So we're looking at a total youth population of 8,512. And we're looking at a Black population of 46% in the school system. And we're looking at a population of 34% or 35% white total. Why am I telling you this? Because this is how we determine disproportionality, okay? So here we go. So the state of North Carolina, this is the data that we are looking at to address specifically. So this is the state of North Carolina on the left. And again, so the percentage of short-term suspensions by race. So we're looking at 55% statewide disproportionate. So the whole state is disproportionate. There's no question about that. And then the county of Lenoir is 70%, 69.2. So if we go back and look at this, so Black people in Lenoir County are 46% of the school demographic. Yet they make up 69% of the school suspensions. Does that make sense? And the same thing for state of North Carolina. So we'll go back and look at that. So Black people make up 25% of the state demographic, but they make up 55% of the school suspensions. And then the state of North Carolina for juvenile complaints. So the state of North Carolina, 45% of the juvenile complaints were school-based. In Lenoir County, 28% are school-based. What does that tell us?
So that's saying most of those interactions are coming outside of the school, just
Yes.
in their everyday life.
Yes.
I'm also curious as to if you were to look at those same statistics, how poverty level affects things like the suspension level. If you compared, how many of those children were living at or close to poverty level versus just race as well.
That would be a good question. That would be a good question. But you all don't collect that data.
Yeah, no, it just was popping into my head, and I'm like, I feel like in Lenoir County, a lot of not only just suspensions, but criminal activity has a lot to do with poverty level or economic base, which leads to all kinds of other challenges that these youth are facing.
So what we could do is look at where you all record their home addresses, right? And we can map it by persistent poverty level, right? And the census tract.
Right, exactly.
We could do that.
Yeah, I had to look at how we could do that. I would be interested to just see how that.
That would be the only way. That would be a way I think we could figure it out.
Right, I think you're right.
Okay. we could try that. That was good. But I thought it was interesting that.
Leanne.
Yes, yes.
I got a question because I'm thinking about what was just said, but
Mm-hmm.
when you look at the racial equity card report and you find out that most families living in Lenoir County are living under poverty, right?
Yeah.
And then you think about too, it dropped right out of my head, just left. But when you think about that, I'm wondering, one may could say, you know, well, maybe maybe it is race, but then when you think of, well, maybe it's not race, but then when you think about it, there are white and black and all other ethnicities who live under the poverty line here in our county, but still we're seeing this targeting of a specific use within that poverty line that encompass all ethnicities in our county. Because according to the reports, Lenoir County is the most economically stratified, and most here live under poverty line. The average household income is like 37, 38,000.
Yeah, I think so.
Something like that.
Mm-hmm.
So, and those are the numbers. So yeah, we could look at it from location where they live, but also what data won't probably tell is that all ethnicities in Lenoir County are affected by poverty. So why is there this specific picking out or targeting a group or a certain group as far as the data is showing? So.
No, I think that that's a fair question. I think that, so we can ask, actually, we could layer it and find out what people are being charged with in those particular areas, right, Janae?
Right, that's what I was
thinking. Are they poverty related?
I know there's a way we probably.
Are they poverty related charges, or are they behavior / violence / whatever else? Mm-hmm. And then that would help us be able to determine better what it is we're looking at. Because I think that that's a fair assessment, which you just added the layer. But I think that we could do that. And so I don't think that it's bad to go, there's a layer of persistent poverty that's affecting things. And then do we want to continue the cycle of the persistent poverty? And this is one of those things that continues the poverty, because we know one of the things that no one mentioned is that if you get arrested, your housing is in danger.
Absolutely.
Right? So, and your whole family's housing can be in danger. So there are repercussions beyond just, me possibly getting arrested, or, and like what Miss Susie said about that, that the fines and things like that can also have an effect on the family. So financially, your family could end up with similar issues. So I think this is a good conversation. Thank you.
Yeah, that housing piece. Go ahead.
Yes, go ahead. Janae?
Sorry.
No, I'm yielding to everything.
Sorry. So I think my thoughts were not so much saying, no, it's not a racial type thing. I think that definitely plays a role, probably still, unfortunately, in this world today. But from my experience in Kinston, is you see a lot of single income families where you have a mother, struggling to work 1 or 2 jobs with children at home. And therefore you see a lot of challenges that those kids face just because of their everyday lifestyle. Mom's at work, so they're home trying to do their schoolwork or do whatever on their own. And they tend to be, late for school or truant from school because they overslept, or they tend to get into a little more mischief, because of their socioeconomic type situation.
Mm-hmm.
That's my experience, mainly from the city. And I don't know that the county, like if you were looking at addresses, I don't know how great, really, even in the city, that would help you. But I think it would give you an idea in the city. But in the county, it's so more dispersed. I don't know that would, give you an accurate representation of that either.
That's fair. But I do hear what you're saying, Mr. Mumford. I think it's fair to say that, if it's a problem across the county, then it shouldn't be just a problem that's posed to a group of people, and to get them to explain or justify why it's harder for them to be able to, what do you call it, survive in difficult circumstances. But at the same time, I do think that I would actually kind of wonder, so knowing that, is this another case that we look at and go, is this disparate treatment? I don't know if you all can follow me on this, that this would be a moment where we go, okay, so do we look at white poverty differently than Black poverty? Do we see Black poverty as a longer term, or something that you can't get out of? Or is it that we see white poverty as just what it is, white poverty, and it's you know, and that doesn't mean it's a crime in and of itself. So I think those are actually really good questions. Go ahead. I sound like somebody was going to say something. Maybe not. Okay. All right, but I think we should research that. I think that's worthy of a question to see if we can figure it out, if it's a possibility. Okay, so we're getting close to the end. Yeah, that's it. So, yes.
Leanne.
Yes.
Now, I do agree. I do agree with, I don't know, who was just talking? I didn't see the name.
Major Spencer.
I do agree that, you know, you do have a lot of parents working 2 or 3 jobs, leaving children unattended. And so there are causes or reasons for, you know, additional getting in trouble, whatever. Yeah, so I do agree with that piece, but I just, if we can study more into the differences of I hate to say it, but well, poverty. I guess, like you said, Leanne, to really see what's the difference in between. You know, is white poverty different from Black poverty?
Mm-hmm.
You know, how is it?
And it's not, you know, and I just think the way that you want to see if people are being treated differently. If you see, if poverty for white people is that they're going and shoplifting, but they're, you know, maybe they're having, what do you call it? They get another chance, or they get to return something or something like that. But Black people maybe are getting treated differently. Or is it that, you know, who calls the police on who? You know, I have one community that they are interested in finding out who's actually calling 911.
Mm-hmm.
Are white people calling 911 on Black people, or Black people calling 911 on Black people? And I think that's a really interesting conversation to have and to examine, and see if who is doing what and how.
Linnea, this is Erin.
Yes.
Can you hear me? Okay. Yes. I had a hard time like unmuting, and I'm a little special.
I got you.
2 things.
Yes.
Because I've got 2 young boys, youngish, I guess.
Mm-hmm.
And while we're picking apart layers, I think it would be interesting to look at which of those households are single parent families, like who's trying to hold it all together.
Mm-hmm.
And, you know, like right now I'm taking the call in the car because I had to pick up my kids, and I just dropped them off at home alone.
Mm-hmm.
And they're 10 and 14, so I mean they're fine, but who's there to do homework? Because after I go home, I've got to be with them and do homework. And a lot of families in poverty don't have, or single parent families don't have that support system to help, you know, with homework and these other things. And I know what it's like to feel overwhelmed. So while we're picking apart layers, which of those households, or which of those kids that are getting into more trouble, which I 100% agree is disproportionate, but while we're picking apart layers, and looking for ways that we can support these children and come together as a community to make it better. What are the single parent households, and how does that factor into what's going on, or them getting in trouble apart from racism issues and disproportionate targeting? Does that 100% real.
It does make sense. It does make sense. I hear what you're saying. And go ahead. Thank you.
Go ahead.
No, go for it.
I forgot the second part.
I'm sorry.
It was something we were just talking about. Oh shoot. I don't know. I'll chime in if I remember. I'm sorry.
So one thing I will, just to kind of, and I think this is a good conversation, but one thing I will push back a little bit on is making sure that we don't go, well, because people have non-traditional families, that is a reason why you would be more likely to offend. Because that's not necessarily true.
Mm-hmm.
I think we should be careful.
I think not more likely, but not having as much support, maybe. And that's just my opinion, you know.
Right. And
that's
I think,
my opinion.
and I think that's part of the reason why I was pointing it out, is that it doesn't necessarily mean that, but I do think that people not having maybe the before and after school, maybe making sure that they're getting the tutoring support that they need, things like that, that lots of parents would need, whether it was 2-parent or 1-parent, that could be a challenge.
Right. And that I do remember the second thing is when we were talking about, do we separate poverty from white poverty and Black poverty? How is it different? And something that kind of popped in my brain was systemic racism. Minorities have been set, specifically Black, have been set up differently without the opportunities to own a home or build these build nest eggs, or without, you know,
generational
I don't know
wealth.
if I'm even saying this right, but just systemic racism, the whole system is set up, you know, where whites have had the opportunity to have people who own property or help or this, that, or the other. We're disproportionately privileged to have those other systems. So while white poverty and Black poverty, you know, you hate to separate it and, you know, hey, is this different, and call it out that way, but whites are inherently more privileged and have more opportunities historically, going back through history, for success than Blacks do. So it's, and I say that to say that it seems that whites have more opportunity to get out of debt or get out of poverty than Blacks do, and it's a 100% unfair advantage. So I think in that regard, you can separate white poverty and Black poverty.
Can I piggyback and just Leanne?
Yes.
Just to piggyback off what she said, that Pete, when she was talking about wealth, we call that, what is it, generational wealth, right? There's a wealth gap where, and explain more of it, Leanne. You know what I'm talking about.
Yeah, you're right. No, you're saying it right. Generational wealth and the wealth gap. Absolutely, you're saying it right.
Yeah, that's not a privilege that most Black or minority children have. You know, the opportunity, you know, to be able to fall back on some form of family finance, a house, land, property, health insurances, you know, life insurances and stuff like that. That all of that, which creates generational wealth. Well, we know through systemically that, you know, African American and minority children don't have that safety net.
Right. Absolutely. Absolutely. So I think what part of this is good. So part of this is, I think, when we're doing the work or we're making the suggestions or coming up with, well, I think what you said was great too, Aaron, that we all have to kind of remember when we're making suggestions or doing the work or trying to come up with what the solution will be or solutions, that we go, remember that not everybody comes to it with the same resources at the table, and not everybody can do it the same way. And so, yeah, But I think this was good. This was just the beginning. I hope that this was a shorter form, but it gives everybody a chance to kind of ponder the conversation and give you a place to start from. So next time we'll do a little bit more on the history of juvenile justice and a little bit more on maybe a little bit more about I'm forgetting right now. But anyway, we'll do a little bit of work on history and some of the contributing factors to what we see now as our juvenile justice and our juvenile justice system and what we're going to try to address disparity-wise. Okay? So we're going to meet next Tuesday, if that's okay, unless there's a big problem with that. We'll be meeting next Tuesday on the 6th at 2 o'clock. And I really did try to wrap this up, but you all started asking questions at the end. Should have asked in the beginning.
We got to get warmed up. Everybody got to get warmed up.
But I'm glad. I'm very grateful for everybody being here. Huh? So with that, unless you all have any other big questions or we can linger on.